Hi, and welcome to the Restorative Wellness Clinician's Corner, a video series exclusively for functional health professionals, where we interview the top experts in the latest research, products, tools, and best practices for getting your clients exceptional results. Welcome, everybody, to today's episode of the RWS Clinician's Corner. And we have a guest that I have been really looking forward to chatting with for a very long time. We have Dr. Ruth Roberts with us. Dr. Ruth is the pioneer in pet health coaching and the visionary behind the original crock pet diet. Good twist on names there. The original pet diet. She's been a guiding light for thousands of dogs and cats on their path to wellness. With her natural approach to healing, she has empowered pets to conquer formidable health challenges from kidney disease to GI illnesses, allergies, cancer, and beyond. Now, Dr. Ruth is taking her mission even further. She is on a mission to democratize this knowledge, making it accessible to all pet parents. Her latest endeavor involves training and certifying holistic pet health coaches, of which I have learned we have several in our community of restorative wellness practitioners, which is wonderful. These passionate individuals will work hand in paw with pet parents, offering holistic options and guidance on home-cooked foods, all rooted in Dr. Ruth's pioneering wisdom. Together, they are transforming the landscape of pet health one pet at a time. Dr. Ruth, welcome.
I am so delighted to be here. And I have to say that you have three FNTP folks that are holistic pet health coaches in the house. So shout out to Delora DeVore, Wilma Shaw, Leah Bookhammer. You guys came in at the early part of the program when I still didn't know quite what the heck I was doing, but saw the value in it. And I mean, you all are doing amazing stuff. So thanks.
That's wonderful. I love it. I love the synergies. Well, I want to start off for those who don't know you and don't know your story. Can you share with us a little bit about, your journey to becoming a vet, but specifically one focused on holistic pet care?
Well, like many of you, I was doing I knew it when I was 12. I wanted to be a vet, and that's probably not the rest of your story. But I was going along in conventional practice, eating the standard American diet, living the standard American life of working myself into a hole, and I got sick. I got fibromyalgia, I got IBS, I got a few more alphabet soups. And at that point, this is back in 05 or so, what I'd seen already was that people being diagnosed with fibromyalgia were being slowly turned into junkies. When the NSAIDs stopped working, they went on narcotics, and this is even before the opioid crisis. But I knew I didn't want that. And I was very grateful to find a functional medicine practitioner in town when functional medicine was still pretty wacky and crazy. So here's this functional med doc in Charleston, South Carolina. And so I went to see him, and he said, well, you're dysbiotic, you have parasites, you have, all these things, the heavy metals, all this stuff. And you need to stop eating that crap that you're eating, eat whole foods, take some supplements. Let's get your gut back on target. Let your hypothyroid and, this and this and this, you have low cortisol, yada, 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 all the things that you hear all day long and you're working with your patients about. And I took a deep sigh and I said, okay, doc, how long is it going to take before I feel better? And he said, 6 months. And I said, what? You mean there's not just a pill I can take to feel better, right? So this is how early I was in the learning experience. And so I buckled down. I did everything he suggested. I was starting to learn traditional Chinese veterinary medicine at the same time. And there were a couple of things that happened. One is I had a dog that developed bacterial endocarditis, which is an infection on the heart valve. I got her through doing the things I knew how to do in conventional medicine. I took her with me to my next class at the Tea Institute. And there they said, okay, do these acupuncture points. Okay. Do these herbs. Okay. And cook for her. And I'm looking at them like, what? That's heresy. What? Cook for my dog? So this dog was not having acupuncture needles. She did think the herbs were okay, and she really thought that home cooked food was a great idea. And I literally watched as a lesion on ultrasound that was about an inch in diameter shrunk down to 3 millimeters, or about the width of a piece of paper. And at that point, there was no going back. I could no longer recommend the bag of food, whether it was the good stuff or the Hill Science diet. And so, fast forward that to many years later, and I committed to doing an integrative only practice in Charleston, South Carolina, which was the first in its of its kind in the area, and then just kept learning from there. But like so many of you, I had my own health challenges, and when conventional medicine had no options for me, I had to find other ones. And so kudos to you for getting on the path to making change in the world.
I think many of us can relate to that. And I'm sure that there's going to be many folks here who can also relate to having, we go through our own health journey, or someone, a loved one in the family, but then we take a look at our animals, right? And it's this like, oh, how can we translate what we know to do for our human loved ones and clients into the world of our pets? So I want to actually just dive right in and talk about diet. I mean, here we are, a group of nutrition professionals. This is what we think about all day long, is diet, right? So it's very natural extension that we want to do right by our pets. And it's definitely something that we get asked about from our clients. And so let's talk about what is the ideal diet. And I understand that you have slightly different, when we think about healthful diets. I know the raw food diet is often touted as like the best diet for animals. So I would love you let's unpack this. What should we be feeding our pets?
Right on. So I will tell you straight up that for cats, raw food is probably the way to go. However, many cats are carb addicts, and so getting them onto that diet is difficult. There is a lot of folks out there saying, "Oh, raw is the ancestral diet for dogs," and that is true, but it's for the progenitor species, the wolf. It's also our ancestral diet, but that's for two species prior to us. And I think that most of us would agree, with the exception of folks that do really well on the raw carnivore diet, that's not the optimal diet for us. So if we back up 30,000 years, when dogs showed up, Neanderthals were already cooking. Homo sapiens learned how to cook from Neanderthals. Dogs started out hanging out with us as a new species from wolves, eating first our garbage, which included our poop, which is why their microbiome is actually pretty similar, and then our leftovers, and then finally what we fed them. Unfortunately, what we fed them changed dramatically starting in the 1950s. So less than 100 years ago, this is when our diets became more processed. We became enamored of convenience and pre-prepared foods as being, the chemistry, better living through chemistry, right? And so that got transferred into our dogs. And what was happening is not only was the food processed, but dog food and cat food was a convenient way to upcycle, which is the new trendy term, food waste products into something that companies could sell. And so they were never designed with optimal nutrition for the dog and cat. I think Alpo was 100% meat back in the late 70s, and then they dropped that slogan. So once upon a time, Alpo was not a bad consideration. But now it's soy, it's wheat middlings, it's processed parts of grains that I don't even know what the heck they are. So this is the big problem. But what I would say to you is that along that timeline, as we went from being hunters and gatherers, we were still gathering grains, vegetables, roots, fruits, et cetera, dogs were already eating those things. We were baking bread over 20,000 years ago, maybe as long as 30,000 years ago from foraged grains. And so that this idea of a grain-free diet, that these are all things that have been made up. We think maybe it's a better way. the pet food companies are happy to oblige us, but present us a processed food in a package that is not suitable for consumption. So my overarching thing is that whatever we ate, they ate. And if we go back to that idea, then I think we're going to help them stay much healthier.
That's fascinating. I want to pick up on something you said there about cats being carb addicts. That just made me take a minute, because I think of humans, of course, we all know the human carb situation, but to think of our pets being in that same cycle. Can you tell us more about that? Is this just, I mean, maybe this is just so painfully obvious and I've just never thought about it for a pet, but that they're just the same cycle that we are, with overabundance of carbohydrates in their food, so they get just as addicted as we do. And like, how do we know if they're carb? I mean, tell us more about it.
So I think if you look at the average bag of cat food, again, this is going to be something in the order of 70 to 80% carbohydrate, and it's really yucky stuff. They finally have taken out a lot of the hidden sugar, so it's somewhat better. But what it's done is teach cats that taste is what they really want. And so all of the things that you could think about with your clients that are dealing with carb withdrawal, this is what we'll see in cats as well when we're trying to shift them off of this junk food onto a higher quality, higher protein, moderate amounts of fats, moderate amounts of carbohydrates. Just making that small shift is incredibly painful. And we'll see cats just refuse to eat anything new because they will only want this delicious sugar pops version of cat food that is really creating problems. And where this started to be an issue was somewhere in the mid to late 80s. We started seeing an epidemic of type 2 diabetes in cats because they're eating A, really high carb food, and B, they're just not meant to do it. But it's so frustrating because all of the behavioral things that you can think of that humans do, like the agitation, the anxiety, if they don't get that next fix of sugar, we'll see cats do. I mean, these are the cats that wake you up at 3 o'clock in the morning because there's only 3 kibbles left in the bowl, or the bowl is empty, and they are not taking no for an answer. So, I mean, it's crazy, truly crazy. And so these cats get grouchy, ouchy, and fat. They get joint inflammation. They feel cruddy because they've got all of this inflammatory stuff going in their bodies. They're storing fat. They're storing more inflammatory molecules in the fat. I mean, it's just nuts. So we've really messed them up. I mean, truly, the bag of food is the worst thing we've ever done to cats.
Right. How do we support them then to transition off of it? Is it one of those things? I mean, I think about some of our approaches with humans. There's we call it like the chiropractic adjustment for your blood sugar handling, right? Where you just rip off the Band-Aid and pull out all the starches and support that. But
Just get Yeah, and cats especially. So the problem with cats is if they are obese and they don't eat for somewhere between 48 and 72 hours, they can develop something called hepatic lipidosis. So you all deal with non-alcoholic version of it, right? Fatty liver syndrome. This becomes quite malignant quite quickly because they're catabolizing all of their fat. The liver gets choked off with all of trying to process the fat, and then they've just released this storm of inflammatory molecules into their bloodstream. So with cats, we have to be really patient. And for one of my own kitties, it took me 6 months to transition her from dry food to canned food, and another 3 months to transition her from canned food to cooked food. And I mean, it was just crazy. I would get samples of food and I would use it for shrimp bait when I still lived in South Carolina. The cats knew when I brought a bag of dry food into the house, and they're like, meow, meow, meow. And I'm like, you guys are still addicts. What's up? So, I mean, it's really, you've got to be patient. And literally, you may start with 1/2 of a teaspoon of whatever the new stuff is to the side of the bowl where she can sort of sniff it and turn her nose up and continue eating what it is she's going to eat. And eventually you can move that to the center of the bowl when she starts taking more bites. I mean, it really is a process.
This is fascinating. Okay, so if we have, we're going to be cooking for our pets, there are certain foods that we eat as humans that I understand are not appropriate for animals. And I'm just going to give a random example. So I will admit, I'm a longtime cat owner. I'm a recent dog owner, and I didn't know this. And someone, instilled sort of the fear of God in me that if my dog ate any chocolate, they were going to be rushing her to the hospital with, so chocolate, as I understand it. And this is based on literally another parent at the playground seeing my dog sniffing like a something and diving in. And then I thought, oh gosh, I mean, I don't feed the dog chocolate, but she's a retriever. They eat things. So what are the things other than chocolate? And maybe you can tell me if I'm not going to, my dog won't die if she eats, a tiny fraction of chocolate. I mean, I'm sure she has, and she's totally fine. But what are some things that we should make sure that they don't get?
Honestly, most of the stuff that is on everybody's list of the top 10 foods to avoid because it'll kill your dog or put it in the hospital, this is all fear-based. Okay. So there are plenty of Labradors that have eaten an entire economy-size bag of Hershey's Kisses and developed diarrhea, and that's it. And they're pooping tinfoil. Everything that so the only two things I can tell you for sure do not ever feed, because really it is a major problem, are Brazil nuts and macadamia nuts. There is something in those nuts that dogs cannot tolerate or process. And really will, yeah. And so xylitol isn't really a food, but yes, not xylitol either. But the other things are all dose dependent. If that same Labrador ate the equivalent amount of baker's chocolate, yes, that is enough to really create some massive problems, create seizures, put the dog in the hospital, and potentially kill it. But the chances of the dog getting into that volume of 80 to 100% cocoa are slim to none. Right. The other things that you'll see, onions, garlic, completely toxic to pets, unsafe at any speed, like the Corvair automobile. No, it's all dose dependent. It's also can create Heinz body anemia in us if we eat enough. That doesn't tend to happen unless you're living during the potato famine and the only thing left to eat is onions. So I think all of this stuff is, we live so much with fear of everything. And this is basically clickbait for pet parents. That kind of stuff. So they're really raisins. In the US, outside of the US, it's not a problem because they don't use a fluoride-based antifungal agent. And I think the raisin toxicity, grape toxicity, is grossly overstated. Is it a problem if a Labrador gets into the Costco size thing of raisins? That's a problem. So again, dose dependency. 2 or 3 grapes for that same Labrador, not a problem.
Right. So helpful. So if somebody is not able to cook for themselves, there are some brands that are kind of positioning themselves as providing that service. So it comes frozen, and you can reheat, and they have done the cooking for you, but it's definitely positioned as home cooked that you just reheat. Talk to us about those brands. Is that a kind of good enough, or are there still problems with that?
So it's all on a scale, right? Like evil incarnate Olroy dog food, which is recalled repeatedly every year, to you're cooking everything for your pet. There's always a scale. So those brands, Just Food for Dogs, Farmer's Dog, Nom Nom, much better than the highest quality kibble, but they're probably 70% carbohydrate. So you're still making progress. You're still getting the benefit from real food. You're still getting the benefit of real vegetables prepared in a way that your dog can process. And there are other brands that are much better. So for instance, Gracious Goodness is a gently cooked diet that is only proteins and vegetables. If you want to add carbohydrates or beans, which I think are still okay, and a lot of people will say that's heresy, you can do that. But what they do is provide you the base recipe into which you can mix other stuff. And, and I'm seeing comments in there, about the sunflower seed oils, all of that stuff. And that's what a lot of those sort of better but not great brands include, is canola oils, sunflower seed oil, all the crappy oils. Again, we're upcycling into the pet market.
Oh, interesting here. And I see a question here. I mean, well, we're in the topic. So what about dogs eating salmon and fish and salmon skin? I feel like our dog loves salmon skin.
Oh, they do. I think that's a great idea. However, so I think we'll get into this in a little bit later. We use some food sensitivity testing, and because, salmon's great for my dog's skin, everybody's feeding it or adding it to food. And so that's now, I would say, one of the top 6 food sensitivity issues we see.
Amazing. So, well, let's talk about food sensitivities, because that is an issue, and we're also familiar with that with our work. So we use a test called the MRT, and I feel like I've heard several people say they've actually done that test on their dogs. But I know I'm not making it up. I can't provide the real examples of it, but talk to us about food sensitivity testing for pets.
So and actually we've been comparing a couple of different companies. And so one of the blood-based tests that might provide better results, but the difficulty is that you have to get the bloods into the spots. And so that's difficult to do at home. And so what we've been using for years is Glacier Peak Holistics. I think they've renamed it to the Pet Wellness Scan. It is a bioresonance test. Now, the reason I ended up on this one is I was comparing that to Dr. Dodd's NutriScan test, and then also blood tests that I could send into allergy companies when I was still in clinical practice. And what I found is that they all had problems. They all had false positives, they all had false negatives. And for the money and for the results, that test ended up being the best roadmap. And the beautiful thing is that you take a hair sample, a saliva sample, you put it in an envelope, mail it to them, and in about 10 days, you get actionable results. And so that's been our go-to. And we have painfully looked at several different testing options over the course of the end of the year and this early part of the winter. And we just keep going back there.
Wow. Okay. That's really helpful. And when you do, I mean, one of the things that we're always thinking about with human clients is when you're addressing food sensitivities with them, we're thinking not just about removing those foods, but addressing the underlying mechanism that allowed that food sensitivity to develop in the first place, right? So, in humans, this is healing the gut. Is that a parallel situation? I'm imagining, yes. And I see you nodding, but can you explain a little bit about how this works with our animals?
Absolutely. The other cool thing is that there is a company called Innovative Pet Lab. And these are folks that have come over from the human functional medicine world and said, why aren't we doing this for our pets? And so now we have a test. You can send in a poop sample and get an idea about where your dog's zonulin level is, calprotectin, secretory IgA, beta-glucuronidase, and pancreatase 1. And there's one more I'm missing. But how cool is that? A poop sample, and you get actionable results. So you can combine that with your food sensitivity test and know what you need to target in the gut to start helping this dog or this cat feel better. And then better than that, you can take your food sensitivity results and then create a rotation and elimination diet. And you guys know how to do that. You're off to the races.
And is it the same as with humans, in terms of you create a diet where you're removing those kind of offending foods, you're supporting, when you're talking about gut healing, are we supporting it with similar type of things?
Exactly. Yeah. And so part of the deal is what can we get dogs to eat reasonably? And so one of the products I keep using is Heartburn RX or TX. I get those sideways, but vital nutrients. So that's got all the stuff you're looking for, right? Diglycerized licorice, L-glutamine, acetylcarnosine, zinc carnosine, all of those things that you would go to to work on your human clients. And y'all, this is coming because I got sick, and this is what I had to do to get myself better. And so I'm like, why aren't we doing this for dogs and cats? And so I figured out how to adapt it for them. But it's the same concepts that you already know.
when people travel with their pets, and I know that you live in multiple different places, and I see, well, you had a little co-pilot there earlier. I'm not sure what
Yes. She's off to, do her thing.
having a little sun snooze. So would you have any specific recommendations around how to manage this when somebody is traveling with their pets?
I think it just, I mean, so in clarity, we've been traveling since 2018. And we, at one point, we rented a magic bus in the middle of Moab, Utah, and we made a batch of food on the wood stove in the magic bus. So it's just, it depends. I mean, for once you get the tips and tricks down about how it works best for you and your family, then it becomes easy. So we would, it's very easy to do on the road. You just got to make plans about how to do it. So for instance, Wilma did a road trip and she froze a bunch of food, and that worked reasonably well. And then I think either stuff defrosted or she ran out, and she ended up purchasing some really high quality freeze dried foods. And so that's another option too. So it's figuring out what your logistics are going to be like if you're traveling quite a bit. I have had clients that froze everything in little individual containers and packed them in coolers to, with bigger dogs, just making bags of food and freezing them.
Perfect. I have a question here that I wanted to follow up on, and I see Courtney has asked it as well. So I'm going to ask it for both of us, which is just before we move on, because I have a lot of things I want to ask you about beyond food. You shared that raw food isn't the optimal right now for animals, for dogs especially. If you have a dog who's eating a raw food diet and is thriving, is there a reason to either supplement with some food that's cooked or to take them off of the raw diet? Like, is there a risk to doing that?
I think that no, there's no risk to it. I think the thing that we need to remember is that down the road, what we used to be able to digest and deal well with gets narrow. So I had a nutritionist a lot of years ago explain life to me like a funnel. And as we get older, our margin for error decreases. What I will tell you is that in the raw food movement, they're now saying, well, our older dogs seem to need a gently cooked diet. And what that means is that the dog had to develop symptoms for the pet parent to realize they needed to do something else. And I think there's a myriad of ways to go about this. Rotating food, I think, is critical. So you could rotate raw, cooked, what have you. And you can do an experiment. All right, if I switch my dog from raw to cooked, what happens over the next 2 weeks? Better, same, worse. And I think that's the thing, is to experiment. There are dogs that absolutely raw diet is the best thing in the world for them. There are dogs that absolutely it is not the best thing in the world for them. So you really have to look at what your pet is telling you.
Yeah, great advice. Look at that bio-individuality, just like with humans, right?
Right on.
I want to shift the conversation now to toxicity and to how to identify when this is an issue for our pets and how to support them. We've had this conversation before, and I want to share this story. So our cat Mimi had a very, very toxic reaction to her rabies vaccine. And so now she has these neurological incidents is kind of the best way I can describe them. We call them fits. It almost looks like she's having a seizure or some kind of neurological event where multiple times a day she just loses the ability to walk. She kind of falls over, or she can walk. She starts to like walk sideways and these kind of really funny motions, and her eyes go all glassy. And we get her to a safe space and it passes within about 20 minutes, but it's alarming. And we clearly not, I mean, she seems like this incredibly healthy, happy, loving, amazing cat every other minute of the day. And then she has these fits a couple of times a day ever since she had the rabies vaccine. And it has been confirmed that it is the vaccine, and et cetera. I won't bore you all with the process that we had to have tried twice before it was figured out that that's what was actually going on. But this is our pets carry a toxic burden. And this, in her case, she had this very significant reaction to a specific vaccine. That's not the only exposure. How do we know if this is an issue? How do we support our pets? I mean, I think about them kind of proximity to the ground. I think of the dogs just like in everything. Talk to us about the toxicity piece.
Yeah, I mean, it's really, at the beginning of the year, I got really depressed because I was digging into the research about this and confirmed a few things that really were beyond horrifying. But think of it this way. As you just said, they're closer to the ground. They're snuffling up the dust particles. They are getting all of the junk that were coming in from the outside world bringing into the house. And so what we know is that the average toxic burden of the dog is somewhere like 63x hours, and of the cat, something where like 93 or 95x hours. And so if you all are working with people, and I would imagine that you're talking to them about doing something every day to help them stay or keep detoxifying, this is really what we need to be doing for our pets. I think most of you would agree that the first thing is diet, and using the diet to help manipulate the microbiome into better functionality so that it takes over some of the detoxification burden from the liver and the kidneys. But it's just overwhelming. So we've had a number, Leah especially, I like to call her our detox queen, but she's been experimenting with detoxification methods using Cellcore products for her dogs. And I think that's a great resource because the fulvic acid, humic acid, the carboxy is a pretty easy sell inside the pet food. It kind of makes things look funny, but it does work well. So I think this is something we really have to do. And then the same thing you would tell your clients, think about your cleaning products, take out the plug-in deodorizers, take out the wick things that people seem to be obsessed with in terms of odors, laundry detergents, all of the things that are going to create particulate matter in your house. And then in terms of what's outside, using HEPA filters and really improved methods of filtering out the garbage that may be outside is going to be critical as well. If you're in like the Southeast, the best thing that ever happened was a UV light in the AC unit to knock down the mold. And that was a huge benefit for me, and I think for a lot of folks. So I think that's something we really have to be mindful of. The other part is talking with your veterinarian. Does my dog really need that vaccine every year? Taking responsibility, Googling incidence of leptospirosis in your area. And I will tell you, I stopped vaccinating for lepto in 1996. So, you have to be proactive as well. So think about the inputs, the pesticides that we're using for flea and tick control. If you're in the Southeast, sometimes you got to use them, but there are many, many, many options. And then, mitigate as many of the inputs into your pet as you can.
So what I'm hearing is if we are encouraging ourselves and our clients to be really thoughtful about the products that we use in our home, in our cleaning, to maintain a clean environment in our home, A, that's necessarily going to benefit our animals as well as us. And B, we want to use that same level of rigor and thoughtfulness in the products that we specifically put on or around our pets. I can think of, we have the dog's water bowl, and I can remember that, somebody who was visiting just like grabbed the bowl and started filling it with tap water. And I was like, no,
No. Yeah.
and they're like, it's your dog. I'm like, well,
Yeah.
why she drank bad water and the rest of us drink good water? I don't understand. I mean, yeah, she's a dog, but she needs it just as much as the rest of us. So I think that's encouraging, I think, for a lot of people, because it's not like it's a whole extra layer of things that you need to do. It's just extend what you're doing for yourself and your family to the animals. I love that idea of just bringing in some sort of ongoing, regular detox things to just, and that's a creative idea. I'm assuming you're talking about something like the biotoxin binder from Cellcore or something like that, maybe opening up a capsule one meal a day or something.
Yeah.
Sprinkling
Yeah,
it in.
that or just the carboxy powder, because that's got kind of less stuff in it, so it's kind of an easier sell, so to speak. But yeah, I mean, and water is critical. I left that out of the list, but that's one of the things we travel with is a Berkey filter because it's so critical. The water supply everywhere where in the world is tainted to one degree or another.
Yes. I'm seeing some questions here about, Molly's got this, question about pets during forest fire season and smoke, and how to get exercise. That's a really good question. What do you recommend on that? Is it better to keep them inside? Get them on a treadmill? I don't know. What do you mean?
Yeah, I mean, God, the last time we were in Utah 2 summers ago, we couldn't do anything because the air quality was at like 150 the whole time we were there. So if you're looking at the AQI and it's over 50, and you wouldn't exercise, probably not great for your dog as well. Someday somebody's going to invent like a whole face filter for a dog so we can actually walk them. But what do you do? So that's where, if you have access to indoor kind of daycare where you can go take them for a run. There are some of these places, especially in communities where the snow gets deep in the winter. Make up creative games in the house. Maybe you're running up and down the stairs or running around the living room in circles like an idiot, and hope that none of your friends videotape you. But you got to get creative, because when that stuff is going on, nobody wants to be outside, and truly it's not safe.
Yeah. Absolutely. Absolutely. I always find it interesting. Our dog, of course, loves going outside, and you can tell there's times where she just knows it's not a good thing. Or when there's, in the winter, this is our first winter in Boston. And so with snow and ice and then salt, and didn't even think about the salt on her poor little paws. And so recognizing that we're choosing where we go very specifically so that she doesn't get that exposure and that roughness, and just
right on. And that's where booties are awesome. So I mean, there's a protective measure you actually can use. And so for the same thing, if we're out walking the dog in the heat, you've got to be very mindful of how hot the pavement is as well.
Yeah,
so
definitely.
all sorts of good stuff.
Courtney's asking she's asked about using titers for as many vaccinations as possible and to try to avoid anything not required by law. But can you talk a bit about any vaccinations that we might want to consider? Are there ones that are non-negotiable for you, or is it context dependent?
So it's all contact dependent. And I think if you look at what are considered the core vaccines, so in dogs, distemper, parvo, rabies, and in cats, I've actually added feline leukemia back in after a decade. I'm not sure why, but FERCP and rabies. If you have a cat, is it going outside? How likely is it to be exposed to another cat and be exposed to the respiratory viruses the FVRCP vaccine is supposed to protect against? You can make that same argument for cats and rabies as well. Do they go outside? No, this cat hasn't seen outside for 10 years. The catch, though, is that there are legal requirements, and there are some communities where they require licenses. Now, for an indoor cat, that's not such a big deal. For a dog that you want to be able to walk around and outdoor, in the community, at dog parks, et cetera, that is a big deal. The problem is that the science has been there since 1993, I think, is when Dr. Schultz released his first papers showing that the duration of immunity for most of the core vaccines was greater than 3 years. It took another decade to get most veterinarians to do a 3-year vaccine schedule, and there's still many of us that do not, which I don't get, but it is what it is. So again, you have to do the research, and there are clients in California where in their community they're required to get rabies vaccines. The dog has had cancer. Vaccination for a dog that's had cancer or autoimmune disease, not a good plan. Sometimes you can get medical waivers written, but most of the time she's just been able to dodge going to get a license for the dog. So that's kind of a roundabout way. But if your veterinarian is not supportive of doing titers, that's a tough one. And then beyond the core vaccines, I really don't recommend anything else unless you can show me specifically in your area that, for instance, leptospirosis is astronomically high, or Lyme disease is astronomically high. But even then, in the case of Lyme, if you give the Lyme vaccine, your dog is still not protected against Ehrlichia, anaplasmosis, and the other tick-borne diseases that we can all list off. And so what becomes important then is tick control.
If you have to vaccinate your animal, are there things that you can do to protect it and mitigate any kind of downsides?
Absolutely. So, for instance, in the US, we have the option of 1 year and 3 year rabies vaccine. Most of the rest of the world, we do not. So, Pio travels, we have to get her a rabies vaccine every year. But what we do is give her Thuja. And there's a root, sort of a mother solution or tincture, as they call it, that doesn't taste great, but you can use it safely at a drop twice a day. A drop per 10 pounds of body weight twice a day for 5 days to help prevent both short-term and long-term side effects. You can also use the homeopathic version at a 12C, 6C or 12C concentration. That's what Hio prefers. And it's easier to kind of get into her that way. So I think, it was really interesting in the coaching calls this morning. I had one student that is absolutely petrified to vaccinate her dog. And I agree, there is way much over vaccination, but I think the level of fearfulness is off the chart. So, does it make sense to inoculate an infant for 30 variants at one go when this child is less than a month old? I don't think so. But there's not been any rational conversation about this on the human side. There's been a little bit more on the veterinary side, but still many of my colleagues are like, no, every year you have to do this.
Right. One more question here. Let's talk. I want to speak to the tick treatment because we just talked about the Lyme disease and tick prevention and tick management. For those of now us in the Northeast, that is a really big issue. I would love to talk about that. And then I'm really, for everybody who is watching this live, I'm going to let you guys. You've got lots of great questions here, so we'll just keep moving through your questions. And you've
Right on.
the questions that I had. So we're all good here. So let's just keep moving through these questions. So tick treatments, tick management, what are the best natural solutions?
So there's a boatload of them. There are Baltic amber collars. Wondercide is a cedar oil spray that's been effective for years. There's a myriad of essential oil formulas. There are electromagnetic discs and tags. So Zero Bug Zone has a tag for both dogs, cats, and humans for ticks, and it creates a different electromagnetic frequency on the surface of the body that repels the ticks. The deal is that if you're going to use oils and things of that nature, you have to commit to spraying almost every time you go outside, especially during high tick season, because you're using it for repellency. So same concept with a mosquito repellent. You can't put it on in the morning and expect it to be good all day long if you're using a natural product. So retreat multiple times, use the other things as needed to supplement. So I think Wondercide, somebody told me, also developed a collar that you can put on. With the electromagnetic tags, you do need to let that build up over 24 hours or so. So once you put it on, you can't really take it off of the dog or yourself for that matter. So they're kind of a pain to use in that sense. Baltic amber, same concept. It's building up electrostatic frequency to repel bugs. So there's just a boatload of options out there.
Excellent. Heartworm treatments, are there natural treatments better for this?
So there is a product made by a company called Amber's Natural, called HWF. And what they can say about the product is that it helps to clear unnatural substances within the body related to cardiac function. So essentially, it is an herbal way to help prevent heartworms. The other thing I would put out there about that is if you use a very simple ivermectin-based product, that ivermectin sticks around in the body for about 24 hours. It kills everything backwards that the dog has been exposed to or the cat. And then you can use something like milk thistle to help the next day to help clear the residue from the body and also to help course the liver 1 week out of the month. Now, the truth about heartworm is that until the temperature in the evening consistently exceeds 55 degrees, the heartworm larvae cannot mature inside the mosquito to where it will infect a dog. And so for many of you that live in the Northeast, you may not actually need any heartworm prevention until June, maybe July. And then further to that, even the American Heartworm Society is saying that heartworm prevention probably only needs to be administered every 45 to 60 days. So taking that all into consideration, if you live in the Northeast, you may give 3 doses, maybe 4 doses of heartworm prevention every year.
Amazing.
Yeah.
That is amazing. One quick question before we dive into spay and neuter alternatives. Dental care, dental health. I don't see a question about that here yet, or maybe there is one down here. That's a big issue. And there are things that people can do. I'm thinking of kind of the 2 camps. I'm thinking those with younger pets who don't yet have dental issues. What do we do to prevent those issues from happening? Do we need to be brushing our pets' teeth and those kinds of things? And then older pet owners, once the dental issues start to appear, are there things that we can do to avoid, all these extractions and, the sort of trauma that seems to happen in so many older pets' lives around dental health?
Right on. So the first thing is feed real food. And what I used to see is routinely people would start feeding crock pet diet and they would come back 3 weeks to 4 weeks later and the dog's mouth is clean. Now, and it took me a while to figure this out and put 2 and 3 together. So part of it is that I think the dog eats the food more slowly, so maybe there's more contact time. But I think the reality is that what was happening is the microbiome in the gut was improving, and then playing it forward, the microbiome in the mouth could start to improve as well. So the other thing for young dogs especially is raw meaty bones, or just raw bones without much meat on them. The more they chew, the better they are, the stronger their jaws stay. With older pets, it's a problem because they can begin to fracture teeth if they haven't been accustomed to chewing. And the other thing that has been super helpful, especially for older pets that already have some dental disease, is again, working on the microbiome. There are specific products like the teeth probiotic, which I think was developed on the human side first. That works great for dogs as well, dogs and cats. And then the other thing is Asclepium nodosum is a specific species of kelp that's been shown to reduce attachment of plaque and calculus.
When you mentioned the bones, is there a frequency that people should be giving their dogs bones, like weekly, daily, monthly?
I think probably two to three times a week is great. I gotta say too, if you've got a dog that has anxiety, it's a great stress reliever.
Right. That's a whole other topic.
Right on. Yeah.
Right. Let's talk about spay and neuter syndrome, which is actually not something that a term that I hadn't heard before talking with you. Can you explain what that is and what can we do about it? Are there natural alternatives?
So this comes from, and the reason you haven't heard of it is because I'm actually actively trying to coin it and bring it up into sort of understanding. And where this comes from is when I started practice in 1990, 90% of the pets were intact because that's just where life was in South Carolina. So, I'm in the deep South, et cetera, et cetera. What I saw over my career is that things that didn't used to be a problem, all of a sudden were a big problem. And what I mean by that is I took out hemangiosarcoma and the rest of the dog spleen that was literally the size of a basketball in my younger years, threw it in the trash, cleaned out the abdomen, closed the dog up, and the dog was fine. Flash forward 8-10 years later, the dog develops a tumor this size, it ruptures in the abdomen, and the dog is dead in 6 months. And what changed during that time? We were doing a really good job at alleviating the pet overpopulation problem. And it was a huge problem. In South Carolina alone, in Charleston County, 43,000 animals a year taken into the SPCA, 38,000 of them euthanized. That's horrible. And that is not where we want to go back. So please don't misunderstand what I'm saying. But what happened is we are capping their ability to have a competent endocrine system at the age as early as 8 weeks. Most often 6 months to a year is what most veterinarians will recommend. So imagine if you ran into a woman that had a full ovariohysterectomy at the age of 35 and was eating the standard American diet, working in a desk job, and then going home and sitting on the sofa. What do you think her life expectancy would be?
Not high.
Not good. Not good. And she would live a very uncomfortable life because her levels of inflammation and all of the things would not be working well. So what I finally realized is that was the connection between why all of a sudden we're with this in this age where we have a statistic from the American Veterinary Cancer Society that 50% of dogs over 10 will develop a malignant cancer. That is asinine and heartbreaking. I mean, that is just beyond ridiculous. And so what are we going to do? So, if you're at the stage of life where you're getting a puppy, you have some options on spaying and neutering, and one of them is an ovary-sparing spay or vasectomy. Outside of the U.S., there is something called a gonadotropin-releasing hormone inhibitor, and the trade name escapes me at the moment. Apologies, but outside of the U.S., this is used for chemical castration in lieu of removing the ovaries and testes. And so we know that, for instance, for women, even if you've gone through menopause, if you have both of your ovaries until the time you hit 64, your lifetime has been extended. If you get the ovaries, both of them removed before the age of 64, you've just lost 4 years of life. So if we can keep these animals intact with at least the basics of their endocrine system going, so much better they will do. And in fact, in Italy, in their veterinary cancer registry, where the majority of dogs, again, are not spayed or neutered, the incidence of cancer in male dogs is 1.1%, and in female dogs, it is 3.2%. They have a higher incidence of breast cancer. I will tell you, I'd rather treat breast cancer than hemangiosarcoma, osteosarcoma, lymphoma, and all the other really ugly cancers. So, so it's easier if you've got a younger dog. You can sort of work things and do something to protect their gonads, basically. If you have an older pet, what can you do? First of all, do all the things we just talked about. Optimize, feed a real whole food diet, optimize their gut function, control their inflammation, improve their detoxification. And that's going to go a long ways. All of my dogs have lived to be 16. And they started out with conventional stuff for the first, 3 to 5 years of their lives. But I did what I'm telling you to do, and this is where they ended up. I've had cats that lived anywhere from 14 to 23, and so this works. Now, the other cool things is that there's a guy named David Bieber, who has a site called Dogsterone. And what he is doing is training veterinarians how to use testosterone to improve orthopedic conditions for older dogs and the frailty of age. So, and if you know your hormone system, you know that testosterone is going to come up and cut off GnRH production from the level of the hypothalamus. And I didn't quite throw in there what the real issue is with all of this. For spayed and neutered pets, the deal is that their luteinizing hormone levels are 20 to 30 times normal. And so what's happening is there's no cutoff mechanism anymore when the gonads are removed. So GnRH is being produced like crazy, luteinizing hormone, and all of, maybe FSH as well. But the thing that's crazy is that tissues that should not have receptors for luteinizing hormone developed receptors. And so we're talking the brain, the adrenal glands, the gut, the bones, the bone marrow, the liver, the kidney. So anywhere you can think of that there is a chronic disease problem in dogs and cats, that tissue is going to have an excessive number of luteinizing hormone receptors.
That's amazing.
So we'll just breathe for a minute. I think you see you all going like, oh shit. That's why, I mean, it's just like, oh, God, it's so, there's so much. And it's like, the more you know, the more um, tempting it is to fall in a deep hole and never come out and figure out how to take action.
I want to do a time check here because per the official clock, we only have 4 or 5 minutes left. There's great questions in here. I want to respect your time. I want to make sure people learn how they can either hire one of your certified pet coaches, or we might have people here realizing that this is their future career path who want to actually do this work either alongside or maybe even in place of working with humans. So I want to make sure we give them that. Do you have a hard stop in a few minutes? Or
no, I'm good. Yeah. And so, and what I will say first is that you have 3 beautiful women in this room who can help you with your own pets. If you know them personally, reach out to them. If you don't, go to my website, drruthroberts.com, click on the tab that says Find a Coach, and then look for Delora, Wilma, Leah. They can help you break it down for your pets. And if you are interested in this, I think, Delora, you've got a link to sign up to get more information about the Holistic Pet Health Coach Certification Program. And it is approved for 40 CE hours for veterinarians and veterinary technicians in the US and Canada. And other than that, I'm the one that's saying that you're certified. But we all have to start somewhere, right, Margaret? I mean, that's what you've had to do with your program, is to know that you were doing the right thing and create a mass of people that are like, yeah, I'm getting it, this works. I'm getting big results from my clients. So that's kind of, it all has to start somewhere.
And so just to be clear, in terms of qualifications for people who want to work in or to want to study with you and become certified, they don't have to be vets, correct? And they don't have to be vets. It's like they can just be, I won't say just, they can be pet lovers, right?
Pet lovers, exactly. The vast majority of our students are either people that are working in rescue, or they're in what I call the pet paraprofessionals. They're groomers, they're dog walkers, they're pet sitters, they own pet stores, they're trainers. We have some vet techs, and we have a lot of human health coaches too. So you would be joining great company.
This is wonderful. I want to just ask a few more questions here. So for those of you who can stick around now, we've got the connections of how to do more. I want to make sure we got that in there before the top of the hour. But if you have the luxury, we have some great questions here. And I want to make sure that we have answered, I think we've answered a bunch of these things here, but I saw an interesting question here about, are there different diet, I can't find it now, but are there different dietary considerations if you have a pet who is indoors versus outdoor?
I think that it depends on exercise level, right? So for frame of reference, Hayo, who's buffing around the backyard, is a mere 6 pounds. We don't feed her a lot of starch because her activity level is not very high. So the main part of her diet is meat, vegetables, and some healthy fats. She'll occasionally get some sweet potato. But then I had an English setter that literally, to keep him at 46 pounds because he was running from sunup to sundown, I fed him 4 cups of crock pet diet, plus an additional cup of rice, plus an additional 2 tablespoons of oil with each meal to keep him at 46 pounds. So this dude was pounding about 3,000 calories a day. So it just depends on your pet's activity level. And some indoor cats, if they're like my brother, who is 6'2" and about this big around, they can eat more. So it just depends.
Absolutely. The crock pet diet, have we popped that link in here just for people who are wanting to get the book and get that resource? We can get that link in there. That'd be amazing. Interesting question here about using local raw honey for dogs with allergies. Is that a strategy that you recommend? And if so, what kind of frequency?
And I think what's easier to deal with is the bee pollen itself. And so literally you might start with 1 grain of pollen. And for a golden retriever, you might gradually build up to somewhere around 10 to 15 grains of pollen once or twice a day.
Amazing.
But yeah, definitely a great idea.
Excellent. Carrie is asking, how would you support a dog that has been in a home with mold?
Oh, let me count the ways. How would you support a person? And really, I mean, and I'm not saying this to be smart, but essentially you're going to be doing the same thing. So we do have a mold support protocol, and I think I will be altering that to include um, this carboxy, the fulvic acid, humic acid, just because it is so much easier to get into these guys. But you can do all sorts of things in terms of, again, whole food diet, work the gut, support the liver to detoxify better, get the basics on board, use bitters to help get the bile to dump. All of the things you would think of for your human clients, you would want to do for dogs as well.
What do you think about, I know our dog's a little too big to hop in at least the sauna that we have, but our cat, who, interesting what I shared, has been vaccine injured. Her absolute favorite place to hang out is the far infrared sauna. And I don't think it's just about the heat.
No, it's not. No, and I get it. I mean, when I had one back in South Carolina, everybody would try to crowd in there with me. And it was big enough that it got a little crazy in there. But yeah,
Yeah.
absolutely.
Yeah. Okay. This is fantastic. This is thank you so much for the incredible resources. What we're going to do is when we prepare your show notes, I'm going to make sure that we have the chat because I'm just seeing resource, 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 resource. So thank you so much, Delora, for joining us and sharing and helping with all of those links. That's really invaluable. Thank you, Dr. Ruth, for your incredible wisdom and for being such a champion and such a pioneer in this field. Our fur babies definitely are so much better off for all the incredible wisdom and resources that you have here. And yeah, getting lots of great feedback and lots of love from those watching live. And I'm sure those watching
Sweet.
the recording will be following up as well. So thank you so much for
My
sharing.
pleasure. Thanks for inviting me on. I'm really happy to be talking to folks that get what we're doing.